Hello and welcome to this course of WHO on occupational health and safety for health workers in the context of COVID-19. My name is Ivan Ivanov and I'm the expert of WHO in occupational health, and I will lead you through this course together with my colleagues in infection control, physical work environment and psychosocial aspects. This course consists of 5 parts. First, I will do the introduction. Then my colleague Alice Simniciano, our expert in infection control, will talk to you about infectious risk to health and safety. That will be followed by a presentation by my colleague on occupational health, Dr. Gwen Brahman, on physical risk to health and safety. Then my colleague dealing with mental health, Dr. Aisha Malik, will explain about the psychosocial risks to health and safety. And finally, I will conclude with the basic measures for occupational health and safety for all health workers in healthcare facilities. By the end of this course, we would expect you to be able to describe the most common occupational risks to health and safety to which health workers are exposed while responding to the COVID-19 pandemic. Also, we expect you to be able to describe the rights of health workers to decent working conditions, how to apply the measures for protecting their health and safety and actively propose improvements, and to be able to access and use the supportive services for protection of health and safety of health workers. What is occupational health and why it should matter for you and your fellow health workers? The goal of occupational health is to protect health, safety, and well-being of workers and people at work through primary prevention and control of occupational hazards, but also through monitoring the health of workers in relation to their work and through promoting healthy behaviors, physical and mental well-being among workers. A healthy and safe working environment is very important for physical, mental, and social well-being of all health workers. The health and safety of health workers is also important for having a good quality of care, for patient safety, and for the prevention of infections in healthcare facilities. What are the most common occupational hazards in healthcare facilities? We usually talk about biological hazards, chemical hazards, psychosocial, and physical hazards. The biological hazards are bacteria, viruses, fungi, or parasites that may be transmitted by contact with infected patients or contaminated body secretions or fluids. Then there are a lot of chemical hazards in healthcare facilities, a lot of various forms of chemicals that are potentially toxic or irritating the body. For example, many chemical disinfectants, drugs, mercury, and anesthetic gases. And there are also psychosocial risks that are factors of work organization, interpersonal relations such as the job content, the workload, the conflicts between workers and clients and patients, harassment, violence, stigma, discrimination of health workers. And there are physical hazards also at the workplace, which are physical factors in the work environment that can harm health. For example, excessive levels of noise, exposure to ionizing radiation, heat or cold, injuries, accidents, and manual handling of loads. How the COVID-19 crisis affects the health of health workers? This pandemic has created excess demands for public health and healthcare services. For example, contact tracing, lab testing, clinical care, disinfection, cleaning. All these are causing new and amplify the existing occupational risks for health workers. The COVID-19 infections among health workers can be acquired at work, at home, and in the community. Health workers may be required to work long hours over irregular work shifts, to wear for a long time personal protective equipment, and to perform some tasks to which they were not familiar before. We also see increasing use of disinfectants, which may expose health workers to hazardous chemicals. We see an increase in social crisis, social problems caused by the measures for quarantine, lockdowns, shortage of health services, fear of contagion that may provoke psychological or even physical violence against health workers, and social stigma. The worries about personal health and health of family members, the shortage of personal protective equipment, facing human suffering, death, all these may affect the psychological well-being and mental health at work. How can health and safety of health workers be protected? There are many measures, different levels of measures that can be used, but not all measures are equally effective. From this diagram here on the left, you can see how the most effective measures compare to the lower effective measures. Those that are most effective are the measures for elimination of the hazard, or substitution of a hazard with less hazardous thing, or providing measures for engineering controls. These are collective measures of protection of groups of workers. And then they are followed by less effective measures, for example, administrative control to modify the behavior at the workplace, different work practice controls, and the use of personal protective equipment is considered one of the least effective measures, though it is the most widely used measure in the context of public health emergencies. Thank you very much for your attention to this introduction, and now let's move to the next module on infectious hazards for health and safety.